So these patients are no longer coming in for one person. They're coming in for the team. And that team effect has a tremendous result. The outcomes in this model are better than I've ever seen in any individual model by itself. Okay, so I have a question that people sometimes give, and I was concerned about this a lot when I first started. I have a great reputation in my community. I love my patients. Am I going to be sacrificing that to do this model? So let me answer that. It's not a simple answer, but let me just give you some insight on that. Well, I had a very large practice, and originally it was based upon me, and I realized for me to grow, I had to get other people involved. So you're creating a team atmosphere. You're getting the right people, and we coach you through how to get the right people. So you have people that agree with your purpose and philosophy, and they're not going to be recommending things you don't agree with. You're going to have multiple aspects now available to you to fix these patients. It's going to include rehab, and the rehab is going to be very consistent based on a model that's been around for decades, and it works extremely well. You're going to be doing chiropractic, and that is up to a clinician. Even if you replace yourself, remember when you first started, you probably weren't as good as you are now. If you have an associate in there, look, a bad adjustment is better than no adjustment. And I'm not saying they're going to get bad adjustments. If you train your associate, they'll be getting good adjustments. But the adjustment will just be part of the equation. They're getting the rehab, the adjustment. They're getting the medical injections. We're not using steroids. We're doing things with very non-invasive substances that actually help to break up adhesions and help to lengthen the muscles that are tight, while the rehab is strengthening the muscles that are weak. You're going to be able to use things like regenerative medicine, which has been shown to really take the patient to another level in healing. And then you're going to have different viewpoints of different minds, all examining the patient and sitting in a team meeting and participating in the team meeting. So these patients are no longer coming in for one person. They're coming in for the team. And look at that mentality of team mentality. If you're a sports fan, let's say you're a football fan, and you're rooting for, my brother's a big fan of Dallas Cowboys, so you root for the Dallas Cowboys, and they have a running back that you really like, and they trade that guy. You go, oh, it's a bummer, I really like that player. You're still going to root for the Dallas Cowboys, and you're going to be okay with the next player that comes in. Just like in this model. If you happen to change out a chiropractor because they decide they want to start their own practice, you'll be able to put another chiropractor in place, and the patients aren't going to give you a hard time because they weren't just coming in for the chiropractic adjustment. They're coming in for the team effect, and that team effect has a tremendous result. The outcomes in this model are better than I've ever seen in any individual model by itself. The sum is greater than the parts. So you'll love this model if you do it the way we teach it. I've been able to reproduce it many, many times, and it comes out very, very good.